mind bringing on our guest, who is Dr. Christopher Ahmad. Doctor, thanks for joining us this morning. We've got a lot to get into. Your bio is fantastic, but just want to check in. How you doing this morning, Doctor?
Mickey, I'm doing great up here in New York. A little bit chilly, but I'm really thrilled to be on with you today.
Well, I know you spent some time in Florida with Arthrex and those guys. Come on down to South Carolina, man. We've got some great weather for you. We'd love to have you down this way for sure. Now, you are the professor of clinical orthopedic surgery at Columbia University. You are the head team physician for the New York Yankees. Doc, I got to tell you, there is no bigger New York Yankee fan than me since 1974. We got to get this thing back, man, and I feel good about the future, so hopefully we can do this thing in the right direction. But I want to talk about Tommy John, something you've written about in books, one of the leading authorities in books, and hard to believe, Doctor, it's the 50th anniversary. I know you did your studying at the place where it was originated. Tell me about Tommy John surgery. For those who don't know, what is Tommy John surgery?
Well, Tommy John surgery, Mickey, is something that truly has been amazing in a revolution of sports medicine, and that is baseball players and now other athletes, as we'll talk about, especially in baseball pitchers, put so much stress with throwing on their elbow, and a small ligament, which is essentially a rope connecting the two bones on the inside part of the elbow, sees so much stress that at some point it can't handle it, and then it tears. And once it's torn, its healing capacity is really poor to heal on its own. And Frank Jobe, back in 1974, 50 years ago, came up with an operation called a ligament reconstruction, and that is where he transplanted a tendon from the forearm. So took a tendon from a different part of the body, placed it in the anatomic location on the inside of the elbow through some fancy drill holes and creative surgical work. And on his first player, Tommy John, the operation was such a success. As you may know, Tommy John pitched more after his surgery than he did before his surgery, and pitched so well that that operation now has become commonplace in baseball and now other sports.
So my guess is, and I don't know this, my guess is that, I mean, that was revolutionary at the time, I would imagine. But like all other medicine, we continue to evolve. Is there evolution in the surgery? Is it different now than it was 50 years ago?
There's been amazing advancements, and you're right. When Dr. Jobe was talking with Tommy John, there was no operation, and Jobe said, "I don't have a solution for you." And the so-called expression, "go back to the farm," meant you actually went home and worked on the farm if you could not continue in your athletic career. And Jobe said to Frank, John said to Dr. Jobe, "Hey, make something up. I am not willing to give this game up." And Jobe gave him a 1 in 100 chance to recover from this. And where we come from there, that 1 in 100 chance, the expectation now is that you'll come back and you'll be better than even before your injury. And why is that? Because the technology advances. And in the world of surgery, we have support, help us with instrumentation such as Arthrex that allows us to be more precise, make the surgery more reproducible, make the outcomes even better. And one of the biggest advances over 50 years occurred about 8 years ago, and that's when Arthrex developed a new augmentation to Tommy John surgery where we can put in what we call an internal brace. And you can think of it as a seatbelt inside the elbow where the surgery is done. You put a seatbelt device inside. It's collagen coated, so it's very favorable to your body because the tendon is made up and the ligaments are made up of collagen. And that seatbelt acts as a protector and allows you to recover faster, accelerate your rehab process, and avoid a repeat injury. And so one of the hardest parts of Tommy John surgery is the length of time it takes to come back. For a baseball pitcher, it's about a year. If you're a elite pitcher, say a major leaguer, it'll take you more like 16 months. Well, that's a long time. This technological advancement cuts that recovery time in half. And so now the players who want to get back sooner and they want to get back more reproducibly, they want to get back. They love this operation. And on the surgical side, it's been really something that's impressed me because I got to live through the evolution of learning the original technique from Dr. Frank Jobe himself. He taught me how to do the surgery. And now we have even better options in 2024 to make players get back safer and faster.
Dr. Chris Ahmad is our guest. Doctor, is there what your parents know about A, the prevention of the injury, and then B, about surgeries and moving forward? What would your message to parents be?
That's a great question, Mickey. A number of years ago, if you asked me that question, I would tell you that it's year-round baseball, just playing all year round, and that it's better to diversify, play basketball in the winter, give your body a chance to recover, especially a growing body. Now in 2024, the concentration amongst coaches, parents, and the athletes themselves is all about velocity. And at the professional level, it was a spectacle. If you had a player on your team who threw 100 miles an hour, that would be something that everybody would come to see. Now every team has got players who throw 100 miles an hour, and multiple players. And in fact, after Tommy John surgery, they come back throwing 100 miles an hour again. So what is that translated to the to the youth player? They want to throw hard, and so they are working on velocity at such a young age, and where they could be working on their craft, and that is deception, working as a player who knows how to locate. But since everything's about velocity, increased velocity is increased force on the elbow. Increased force on the elbow means more injury, and for me, I can't keep up. I do about 8 to 10 Tommy John surgeries every week, and the largest population are adolescent and college players.
Is there a risk? Because you hear guys, the joint's gonna be stronger, the arm's gonna be better, right? Is there a risk for young people? And you hear stories, at least. I don't know if it's just tales of this, where kids want it despite not needing it. Is that a factor? Because hey, my friend had it and he's throwing better now, and I'm 16 and I want to play in college. I want to play professional level. Do we see that as a factor with the surgery?
I see that so often, Mickey, and it's really troubling, as you can imagine, because there was a reference to it as the next student steroid, and that is, let me just go get a surgery where I don't even have damage in my elbow, and a rationale to get stronger and to throw harder. And from a medical perspective, we celebrate when the surgery goes well, and it has become an amazing operation. But there's a toll to it. After the surgery, you have to grind, and many patients don't realize that. And what I mean by grind is you're doing therapy 4 to 5 times a week for a couple of hours, and you do that for 6 to 12 months. That is not just a physical grind, but it's a mental grind. And sometimes athletes don't recognize that ahead of time. So not every surgery goes perfectly either, and we like to believe that everyone will be back, and in fact, our success rates are so high. But our message to families and kids are, take care of your body, take care of your elbow, and that is with proper mechanics, proper throwing volume, don't throw too much, proper rest period. We don't pay enough attention to, say, sleep and nutrition. And number one, if your elbow is hurting, you should not throw through it, because that's a sign, it's a little spark, it's a little fire that we don't want to turn into a flame that evolves into a damaged ligament.
Dr. Chris Ahmad is our guest. Doc, are we, in sports, I see this all the time now, especially in Major League Baseball, because you got huge salaries. And I know there's a guy, he feels a twinge all the time. We have to be careful. Talk to me about like the MRI process and the athlete today compared to when you started this thing, long ago. It seems like we're pretty careful now, and we're finding more now. And maybe, look, if I'm going to pay somebody $100 million, I'm going to be pretty careful with that product. Does that make sense?
That makes complete sense. And, players are assets now. And there's a value associated with them. And let's talk about MRIs. In 1974, when Tommy John injured his elbow, there was no MRI. Dr. Jobe made the diagnosis by physical exam and X-rays, special stress view X-rays. So now in 2024, our MRI techniques are so sophisticated that we can recognize tears early in the process, location of tears, because believe it or not, the location of the tear within the ligament, if it's at the top or the middle at the bottom, affects its internal healing capacity. So if you have a tiny tear at the top of the ligament, you rest, you're going to be okay. And we can find that out on MRI. On the other hand, if it's a tear at the bottom of the ligament, that tends not to heal well. Poor blood supply, the way the ligament inserts. So we recommend more aggressive treatment there. And we're not at the point where we do surveillance MRI scans, throughout the season, before and after a game, and so forth. But there's going to come a time where imaging in that capacity is going to be our future, where we can, say, find an elbow at risk and help avoid an injury before it happens.
That's crazy. But yet, like you said, it's an investment, and to call a player an asset. That is exactly right. Let me transition if we can, because Brock Purdy is going to play in the Super Bowl. Not only a guy with his pre-draft situation was at a long shot, but also he had a UCL repair as well. Talk about Brock and the Arthrex internal brace. We already talked a little bit about that, but about his recovery and how well it's gone for him and really changed his entire career.
Well, this is the great thing about sports, and as a sports medicine physician, we can take care of athletes that are outside of our, say, primary scope. I'm primarily taking care of baseball players. But when you have a technology and someone else suffers that same injury, where there's massive expertise within the baseball sports medicine world, we can apply it to other sports, including football, wrestling, take care of so many wrestlers, they're their UCL. So let's use Brock Purdy, an elite quarterback who sustains a UCL injury that is so common in baseball. He had a seasonal timing factor that was interesting and an injury mechanism that was interesting. So his injury mechanism, often in football, you can injure your UCL as a quarterback by a direct blow onto your elbow, a collision, land onto the ground, a player lands on top of you, and it's not a throwing-based mechanism. Brock Purdy was attempting to throw, had his arm blocked, and then sustained an injury. So he had more of a high-level, high-energy injury to his elbow and a throwing motion. That meant that his ligament was torn and was going to be really challenging for him to get back to throwing with non-operative treatment. There was a chance in general for ligament tears and quarterbacks to heal with non-operative treatment, but it's a little bit of a roll of the dice. And if it doesn't work, you can still go back and have surgery, but you lose time. Now, if you get hurt in January and there's an operation that can get you back in 6 months predictably, and with low risk now, with the Arthrex internal brace as a option to accelerate the recovery and make it durable for the rest of your career, we're going to see more and more athletes, and this has been the transition for me in New York in the past 2, 3, 4 years. Patients who would elect initial non-operative treatment prior to the Arthrex internal brace was high. Everybody would say, let me give this a chance to heal. Now, essentially, everybody says, Doc, you're telling me I can be back in 6 months if I get this operation, and it's going to take 30 minutes to do? And so Brock Purdy had the Arthrex internal brace repair strategy employed, and look at him. He's doing great, and now he's competing in a Super Bowl.
All right, final one. I do this with Dr. Steve Martin on this segment every single week, and I always ask him my misconceptions. Am I wrong, Doc, or tell me where I'm wrong or if I'm right about this. A Major League Baseball player, because of the work you guys have been able to do with the Tommy John stuff and the great stuff there, that I'll see a guy sign for $50 million despite just coming off Tommy John surgery, and the team might not have any idea what he's going to come off of it. But a shoulder surgery seems to me like it's a bigger risk. Do I have a misconception about that?
Mickey, you're exactly right. I'll tell you the good news and the inside intel on that. The good news is the amount of shoulder surgeries in baseball players or pitchers for throwing is going down. There's less and less over the years, and that's because the shoulder reacts to rehab and preventative strategies extremely well. And every major league club, college teams, they have programs around shoulder health. We even call it shoulder hygiene. You have to keep your range of motion, do rotator cuff strengthening exercises, you do recovery afterwards. lots of we call them modalities, where you get your muscles managed after you throw with needling and scraping and all this soft tissue work. And the amount of surgeries for shoulder problems have decreased because of exceptional physical therapy strategies. On the other hand, if you finally do break down with a shoulder problem and require surgery, the surgery is much less predictable. The recovery path is much less linear. There's going to be bumps in the road during your throwing process. Your shoulder gets sore. You have to take some time off. And so that's been tricky. Having said that, working with a company like Arthrex, we get better and more clever with our ways to treat shoulder injuries with arthroscopy equipment, which is the camera that we put inside, and the repair techniques with very specific sutures. And I'll just add to you, we're celebrating 50 years of Tommy John surgery performed by Dr. Frank Jobe. Dr. Frank Jobe did oral Hershiser surgery, and oral Hershiser had the first anchors placed to repair labrum in a baseball player using labrum, to repair the labrum using these specialized suture anchor materials. Arthrex has revolutionized and every year comes out with new and improved suture anchors. So hopefully the baseball shoulder will be better treated more predictably as we get better at it.
All right, Doc, I only got about a minute, but I just want to say, man, you've got the coolest bio. Your entire career, how many books and chapters you've authored, and the athletes you work with through Major League Baseball and all of your associations you're with. Just in the final couple seconds here, we'll talk about your career a little bit, man. It's got to be, you've got a pretty cool work environment and athletes you work with every single day.
Well, thanks, Mickey. I got a little bit of a poetic career. I grew up playing soccer, and I wanted to play soccer my whole life and play at a professional level. And I played at Columbia University, and at the same time, I studied mechanical engineering. Mechanical engineering is learning how things break and how to put them back together. And I had the idea, if I'm going to stay in this game and if I'm going to stay working with athletes, I have an opportunity to serve them through a career in sports medicine, where if their dreams are compromised because of injury, I can have impact on them. So I went on to become a physician, a surgeon, and at Columbia University, where my dream started. I did a fellowship with Dr. Frank Jobe in Los Angeles, and that's where I learned Tommy John surgery, the most fascinating injury in surgery there is, where this ligament that allows you to throw 100 miles an hour can be rebuilt. And so I dedicated my career to managing this one ligament, everything from diagnosis to surgical treatments that could be improved. And now, 21 years into my practice, I work at Columbia University. My operating room is right outside the soccer stadium where I grew up with the dream. So every morning that I go to operate, I look at the field and I take a moment to express gratitude with the opportunity I have to help athletes who are injured.
We do this segment every day, every Monday, and we try to talk to parents and adolescents, or parents of adolescents in sports, and I want to encourage all those. After the break, I'll tell them more about some ways they can learn more about you and learn more about the books and some of the things you've written in the past. But Dr. Chris Ahmad, I can't thank you enough. It's fascinating stuff. I appreciate Arthrex setting it up, but I can't thank it. Let's do it again. I know you're busy, but I'd love to do it again because there's so many more fascinating things that parents can learn from you and your great studies.
Well, Mickey, thanks for having me, and I'll tell you this, in my career path, right now one of the biggest factors in preventing youth injuries is not me teaching other doctors how to do a better operation. I think of it as setting up guardrails, and that is these players are pushing their bodies, they're on the edge of a cliff, and when they fall off, I'm at the bottom, I get them back together, and I put them back up on that cliff where they're pushing their bodies again. I think there's an opportunity for you and I to set up some guardrails through education to the people who affect our players the most, and that's parents and coaches. So I couldn't be more thrilled to be on this program, and look forward to you having me back again.
Well, let's do it soon. Fascinating stuff. Thank you for your time, Doctor. Have a great day, and we'll be in touch, and let's do it again.
Thanks so much, Mickey. Have a great day.
Yeah, you too, Dr. Chris Ahmad. What a fascinating guy that guy is. When we come back, I'll tell you more about his bio, but that's really cool stuff. We'll take a break. Come back much more after this.